I'm actually just finishing up the day, finishing up some charts, and I thought I'd just jump on here on live and see if anybody joins up or has any questions. Feel free to ask. I'll probably be on here for maybe 10, 15 minutes. But I did want to say I have had someone commenting on my videos asking me the same question, and so I want to see if I can address that. The big question being, is it possible for you to cross your eyes too much? You know, maybe is it possible for your eyes to get stuck like that? You've all heard maybe your parents, mom, dad say, hey, don't cross your eyes. Your eyes are going to get stuck like that. And so the big question is, you know, hey, is that bad? Can that actually happen? Or is it bad to even cross your eyes too much? And the short answer is no. So can't get your eyes stuck like that. So I'd like to set your minds at ease. Hey, hello, AJ Waffler. How's it going? But yeah, just want to set your minds at ease. Can't get your eyes stuck by crossing them. And along the same lines, is it possible for you to cross your eyes too much and damage your eyes? Can you uncross them too much? And really the answer is no. I mean, because it's a voluntary eye muscle control. So you're voluntary crossing your eyes, and it won't damage your eyes. The most you'll do is probably eye fatigue, especially if you do it a lot, because it takes a lot of eye muscle power and control to actually boom, bring it in. And so won't hurt your eyes, can't cross them too much. Because yeah, there aren't tendons that are going to get stuck or anything. You'll just get fatigue. Doing well. I had a crazy day in clinic, kind of fell behind a little bit, and so that's why I'm here. It's almost 7 o'clock where I'm at, and so I'm here finishing up charts. And yeah, it is a good night. Yeah, it's in the evening. But hopefully I can finish up the charts and then head home to the family. But I thought I'd jump on here. I've never done this. I thought hey, let's just see what it's like, jump on here. So if you have any questions or anything, but hey, what? Thanks, Rory. Yeah, so a lot of people say thanks. I actually feel like I need to thank you. Really, it's like one of those things that feels like it gives me meaning in my life, even though I have a lot of those things. But this is definitely one of those where I feel like I can at least try and give back, help as much as I can. So yeah, thanks. So I have one eye that moves toward my nose. I'm old. Can vision therapy still help? Ooh, this is a good question. So it depends on what's causing the eye to move in toward your nose. Is it a eye muscle issue, focusing issue? It's probably an eye muscle issue, and I'm guessing you've probably had it most of your life, if not all of your life. That's my assumption. And you know, initially I probably would have said, you know, maybe not at this point if you're kind of older in your age. Yeah, most of your life. Initially, I would probably say no. Usually, you know, as you get older, like your eyes get set in their ways, and just they don't want to work, or they don't want to respond to therapy and treatment. But a lot of things that I've been reading, especially lately, I'm trying to do some videos on this, that vision therapy has actually been helpful for people, not only strengthening their vision, but strengthening their eye muscles. And sometimes their double vision gets less, straightens the eye. So it's kind of maybe rethink some things. And so it is possible, probably depend on the amount of the deviation, so how much the eye is actually turning. But it's possible. You know, it might be worth looking into. If it's too much and your eyes are too set in the ways, then, you know, maybe the doctor will say, hey, it might not be worth it going through vision therapy and everything. But I don't know. You know, if you're my patient, I'd at least say, hey, it's an option. Because nowadays, I don't know, it seems like some research is showing that, hey, it could help. What's good for eye nevus? I'm guessing, like, what can you do for an eye nevus? So an eye nevus is kind of the version of an eye freckle or a mole. Usually when we're talking about that, either the nevus can be on the white part of your eye, the colored part of your eye, the iris, most commonly found in the retina, the back of the eye. And it's just like a little brown spot, mostly a brown spot or a dark spot of pigment, kind of like a mole is. And usually you don't have to do anything. You kind of treat it like a mole where you watch it, see if it's going to grow, double in size, get weird. If it does get weird and it grows, then that's when you have to take the next step to start investigating to see if it's, bad, a cancer or anything like that. But when it's a nevus, and I see that all the time. Today I probably saw 6 of them. And yeah, you just take pictures of it and watch it pretty much. Oh yeah, Kate, so yeah, double vision, wear glasses with prism. Yeah, so that's probably to help with the double vision. Yeah, so it's hard. I mean, I have seen people with double vision or an eye turn, and they do vision therapy, and they're older, and it might not get rid of their double vision or get rid of the eye turn, but it helps with eye strain, maybe lessens the amount of prism, kind of keeps the eye muscles in check, and so that's something to consider too. Do you have eye floaters? I do. In fact, I was just tracking them today. Actually, in fact, here I have a white screen up right now. I can't believe I'm doing this on live, but I do have eye floaters. I can actually find them if I catch it. There we go. Left eye. Yeah, so my eye floaters are definitely vitreous floaters. I have a few of the hairs and kind of glob goblets that are sitting in there. And yeah, if I catch the light right when I'm driving, blue sky, boom, I see them all the time. Annoying because I usually tell people all the time, hey, you can get used to it. You won't notice it as much. But because I talk about it all day and I constantly look for my floaters, I don't ever get used to it. So curse of being an eye doctor, I guess. I don't know. Okay, so I have dry eyes, and after taking your advice, I got better. Wow, thanks. My question, did drinking water too much, did drinking water too much may fix dryness? So this is an interesting question. Maybe this is what you're asking, but I used to say all the time, hey, baseline, make sure that you stay hydrated, which is good for dryness, but there has been a study that came out saying that maybe drinking more water is actually correlated with having dry eyes or too much causing dry eyes, which was kind of crazy to me. I actually looked into the study, and it was actually a survey study where they surveyed a large group of people, and they found correlations. One of them was how much water they were drinking and dry eyes, and they found a correlation there, but that spawned another study that hasn't come out yet. And so I'm skeptical on that one, just when they're surveyed dry eyes, pretty much when they're asking people about water and their dry eyes. And so it's kind of self-reporting. It's not necessarily a study that was done on someone's eyes. And so, I'm skeptical, but that will be super interesting if we find out that, hey, if you're drinking too much water, you're causing dry eyes. Which could happen. So this will be interesting. Does optometrists recommend using digital bifocal when progressive doesn't yield good results? So it depends. Definitely depends on the person and what you're doing as far as work environment, working on the computer. And if you mean by digital bifocal, are you meaning the lenses still has? So there's still a digital lens that has the line bifocal in there, and but it's made so it has less aberrations, clear on the edges. But there are digital bifocals that you could be meaning where it's a sync lens or an anti-fatigue lens is kind of a training wheels for a progressive. And that's a possibility. So if you're having a hard time adapting to progressive and you're kind of early stage presbyopia, just getting into progressives, then digital anti-fatigue lenses can be called digital bifocals, could help, at least get you in the right direction. I am not going to finish any charts, am I? I don't know what I was thinking. I thought I could answer questions and finish charts. Not going to happen, but this is fun. Can retinal artery occlusion ever be treated? So the lasting effects and the damage of a retinal artery occlusion, meaning you have an occlusion, blocks blood flow, resulting in damaged retinal tissue, which can result in vision loss, maybe peripheral vision loss, depending on where it's at. The tissue can't come back. So it doesn't, as far as like vision goes, a lot of times we can't get that vision back, which stinks, unless you catch it really early. And that's key with retinal artery occlusions. If you can catch it, I mean, as fast as possible, then that's your best chance of limiting damage and hopefully getting some vision back, or helping regenerate the tissue down there. Sorry, I'm trying to catch up. Hey, what do you think about finger prick autologous blood? Yeah, as a treatment for dry eyes. Love it. Actually, we are been wanting to do that for our office for a while. So I'm in an office of 7 doctors, and we actually been talking about that in our doc meetings recently. Been wanting to do it for a while, so we are looking more into doing that. And it can be beneficial. I've seen some patients where that's like the one thing that's helped their dry eye the most. And so whenever I hear that, I'm like, I got to jump on that. There's an eye floater that I've had for like 2 years that I see all the time. I would say I'm pretty good at ignoring them. Yeah. That's probably how I am. Like if I look for it, I see it, bright light, I'll see it. But most of the time it's not bugging me or anything. Like when I'm working, doing an exam, I'm not, the floater's not getting in the way or anything. I'm lucky that way, but some people don't aren't that lucky, which kind of stinks. Hey, Letitia. Can astigmatism occur by staring at a computer, smartphones, or is it hereditary? Definitely a genetic component in it for sure. And so a lot of times as parents have it, we see it all the time where the kids can have it. The staring at the phone and the screen, not necessarily, so this is where it could possibly, if you are doing a lot of squinting at the screen or your eyes are dry, you're doing a lot of knuckle rubbing, that's been kind of linked to astigmatism. If you do a lot of that, like if you have eye allergies, eye rubbing, on top of looking at screens and smartphones, then that's kind of at a risk for keratoconus, where you can actually curve or cone out the cornea, which can cause irregular astigmatism. So not necessarily the screens themselves, but if you are squinting, pressing on the eye, rubbing the eyes because they're getting dry, then could possibly. What good for eye nerves? Eye nerves. So there's a few things I'm thinking about here. So there's sometimes people can have what's called neurotrophic keratitis, where the nerves in their cornea can degenerate. Kind of can happen with LASIK. So the nerves are destroyed or damaged during LASIK. Can cause painful eyes, kind of under a category of painful dry eye. That bugs me. Sorry, I'm going on a tangent. Dry eyes kind of bugs me because there are so many different causes and categories that are just lumped into dry eye when it should be separated. But this is kind of one of them, kind of a separate thing. But they have kind of studied that. There's one drop called Oxervate that's been out that can regrow nerves, but it's one of the most expensive medications available, I think, in the world. I don't quote me on that, but I mean, last time I looked into it, it was like $25,000 for a bottle of the drop. It is like crazy. So crazy stuff. No, I mean no line bifocals. Yeah, so that's probably the digital anti-fatigue lenses that can help. It's not as aggressive as progressive. It's kind of like eases you in a little bit. Still gives you that near aid in the bottom. I think that's what you're talking about, and that can actually be helpful to kind of get you into it. Is it okay to look at the ground during the eclipse? Yeah, definitely. So without your filters, looking at the ground, there's some tricks that you can do to look at the eclipse, like using the colander or the pinhole projector. What we did is we put a white sheet on the ground and we did the colanders, and even like the leaves blown over the white sheet would show the eclipse kind of coming over the sun. So super cool. I actually like that better than actually looking at the eclipse, but at any moment, if you look at the sun with the eclipse, you're going to want the glasses on. You want to put them on while you're looking at the ground before you put them on there. Don't go look at the sun and then put them on, because those little few seconds can add up and kind of stink. Which is better for dry eyes, cold or hot, blindfolded? I'm guessing compresses, cold or hot compresses. Good question. I'm I'm kind of working on a video right here where talking about warm compresses, how they can maybe make the dry eyes worse. And it really depends on the person. A person that's dealing with inflammation, rosacea, inflammatory blood vessels that are in there. A lot of times the warm compresses can actually flare that up and actually be worse for the feeling of the eyes. And that's where cold compresses can come in and actually kind of help with the inflammation. So if you're kind of dealing with inflammatory dry eye, rosacea, cold compresses might be the way to go. There are some people say that you can alternate warm compress and cold compress. But yeah, that's a good question. I'm heading into my second year of optometry school. All right. Any advice as I start seeing patients independently for the first time? Can be nerve-wracking. And you're going to take a long time, because in school they teach you to do every test, which is good. You want to know how to do every test. And so just plan on taking a long time and run with it. But it's actually fun. I have like fond memories of my first patients and going through it. So I just enjoy the moment. It's one of those enjoy the moments. It's going to kind of stink, but you're going to look back on it and go like, oh, that was kind of cool, because it's just kind of unique. You remember your starting point. So it's kind of cool. And congratulations. So good luck. Is it okay to look at the ground during the eclipse? So did I go back? Yeah, so it is. Okay. Is it okay to look at the ground during the solar eclipse? Why is everybody? Yes, look at the ground. I am from India. Is eye surgery safe? Please reply. I guess depends on what surgery you're wanting to do and what it is and where you have it. That's a hard question. I would hope that it's safe wherever you're going to have surgery and whatever you're going to have done. But yeah, I guess I'd need more information. But if your doctor's recommending eye surgery and there's a surgeon that can do it, then I would assume so. Okay, I think I caught up on the questions, unless is that it? I think that's it. Are people, I don't see any more questions, so I don't know if I need, oh, here we go. Doc, I had atopic dermatitis on my face and eyelids 4 years ago, gone from the face, but it's gone inside of my eyes, and I have painful eyelids, dry, itchy, watery eyes. So the dermatitis, flaky eyelids, I guess you're still dealing with it. This is one of those things where, so I have to be careful, so it's, I can't give recommendations on treatment, so it's kind of tricky on here. So I'm assuming, so as an educational standpoint, so there's dermatitis where you can have inflammation, but sometimes that can turn into a blepharitis. You'll have bacteria that can be mixed in with that, or you can have mites. So you can have Demodex mites that are in there as well. Using eye drop, not helping, my eyes got smaller in size. Oh man. Yeah, so so I'd be curious if we're dealing with some mites, especially if someone's used eye drops to help. If there's flakes on the eyelashes that are in there, especially on the base of the eyelashes, I'd be curious if there was Demodex in there, little mites in there. And that's where, where you start looking into trying to kill the mites to help with that. So you're looking at tea tree oil. Extemvi is an eye drop that's been working really well. I'd probably look into seeing what people are using to clean their eyelids with and how much inflammation it is. Again, yeah, it's hard to say anything, especially without examining, your eyes, but I can try and give broad educational tips there. Let's see, 25. $25,000 US. The name of the drops for the eyes. The name is, I'm from Jamaica. 25,000 is the name of the drops for the eye. Oh, 25,000 is the price of the Oxervate drop. It's crazy. $25,000 US dollars. Yeah, it's nuts. Hi Doc, wanted to know that you were also facing dry eye syndrome. I do. So I have blepharitis that flares up. I have to clean my eyelids every day. Definitely dealing with a dry eye, my Bohemian gland issues. And so I do the warm compress. I am in the routine of things. What's tricky though is I want I want to test all these new dry eye, either drops or treatments that are coming out. And so I want to know if they work. And so what I do is I stop my dry eye routine, dry eye treatments, give it a couple weeks, and then I try the new dry eye treatment that I just want to test out. And so sometimes I don't do myself any favors because I just want to test it out so I can, if someone asks me, if I want to help patients out or if I want to do a video about it, I just want to be knowledgeable how it feels or what it's like. And maybe that's not the best way to test it, but I just want to know. And so I do deal with dry eyes, and sometimes I just do it to myself, which stinks. So, yes, Demodex mites cause blepharitis. Use Xdemvy for Demodex and it helped. Oh, yeah, there we go. Yeah, good. I've had patients that have been using it as well. I've I'm testing Xdemvy right now. It's a 6-week course. I'm about 3 weeks in. I'm just doing it on one eye. So this is one of those things where I kind of stop everything and then I'm trying the drop and I'm just testing it on one eye just to see if I notice a difference. And yeah, so that's what I do. Hey Doc, an infection of the maxillary sinus can manifest as what kind of signs and symptoms in ophthalmology? So, not many, but sinuses are weird when you're dealing with eyes, but you're kind of dealing with the sinuses that are up here. But I've seen where people might have surgeries or clear up their sinus. I've seen prescription changes. Sometimes when you're on medications, if they put you on steroids, that can change medications or can change, you start affecting dry eyes. I've had people that have more watery eyes from it. It's tricky. Yeah. Doc, why does my vision get blurry when I stare at a screen? So I kind of have a video about this. Well, a video that I did a year or two ago about as far as dry eyes go, why it causes blurry vision. Along the same lines, staring at a screen, blink rate drops by 60%. So we're staring, we're not blinking. Tears evaporate off the surface of the eye. Tears are the first line of focusing on your eye. It's not the actual tissue, it's the tears. If the tears are gone, you're off to a bad start as far as your eyes focusing for clarity of vision. On the same lines, if the tears are evaporated quite a bit, you can develop these dry patches on the surface of the eyes called keratitis. And if you get that near the center of your vision, those dry patches can actually blur up the vision as well. And you'll have fluctuating blurry vision, and maybe you'll go to bed and wake up like, oh, my vision's clear because it healed up. And so it's tricky with the screen time. So you definitely want to take the breaks, use eye drops, kind of keep those dry patches from showing up. Okay, hi doctor, I have itchy eye allergies due to an environment like pollen. What brand do you recommend? Okay, so eye allergies, if we're talking about eye drops, really good eye allergy drops are Pataday. You can do it once a day. I usually do the extra strength, the normal and the 2-day one. I'd stay away from the red labeled one. I usually go with the green label, it's the extra strength, or the blue, which is twice a day. And then Lasticaft has also been a really good one too. So those two are my top that we use in my family, and I usually recommend to patients. So, and those are over the counter. Okay, starting my first rotation of 4th year next month at a private practice. Cool. Currently considering residency for primary care or ocular disease. Did you do a residency? I did not. Wish I did. So if that helps, I would definitely do it. kind of can springboard you. We were kind of in a situation that we're trying to have a kid and going through IVF and stuff like that. I guess, I don't know, I guess I'm divulging personal stuff on here, but so we're kind of needing money and getting started, and so we chose to do that. I wish I had gone the residency route if we weren't dealing with that, but I was lucky enough that I actually started in a pretty high medically minded private practice, and so I did, right out of school, do a lot of medical eye care. So I feel like I did get my feet wet as far as doing medical optometry, because the practice that I started at was pretty heavily medical minded. So I did get a lot of experience that way. Congrats though, that's exciting. How much does the electric toothbrush help for dry eyes? Yeah, so that's that's one of those experimental videos I did, which I was worried about, because that was just a personal experience, not recommending it to anybody, but I was just curious about stimulating the trigeminal nerve in a way that wouldn't be chemical based, doing the spray or buying the iTier 100, so the external stimulator. So I just wanted to see if there's a way to stimulate the trigeminal nerve with something cheap that maybe a lot of people had already. And so I did a whole month test on that, and it made a pretty big difference in my eyes. I've had some people do it and they say their eyes don't even water, but when I was doing it, my eyes would water like crazy. And at the end of the month, I did feel like my baseline tears were better. In fact, there's been a few times that I still do it, actually. It's just because if my eyes are dry enough, then I'll do it. So it made a difference for me, but not something that I can just flat out recommend, because it's not a legit studied treatment, FDA approval treatment. So as a doctor, I can't just like, hey, put a toothbrush to your nose, so it's one of those tricky ones. But for me, it was pretty good. Okay, so I have meibomian, I have a little bump on my eyelid, and I'm losing my eyelashes. Is there something I could do to help? So I'm guessing, you might have meibomian gland dysfunctions or problems with the meibomian glands. I have a little bump on my eyelid, and I'm losing my eyelashes. Yeah, so bump on the eyelid, that can be from a clogged oil gland. I'm assuming that's what you have. So that's where I would start, is trying to focus on your oil glands. Now, losing your eyelashes might be something else. And so that kind of makes me wonder if you might be, I don't know, again, not your doctor. I'm just thinking out loud here. Definitely check with your doctor, but I wonder if you might be dealing with some Demodex or mites in there. So mites can do that. Mites can actually burrow, live inside the hair follicles, can cause some eyelash loss. Meibomian contributes to meibomian gland dysfunction, styes, hordeolums, bumps. So if someone told me about that, that'd be the first thing I'd look for as a doctor, if it was my patient, is to try and investigate for that. And then yeah, treatment for it. Hey doc, I use the VR headset to work Monday through Friday for about 8 to 10 hours. What do you do? Whoa. Aside from dry eyes from not blinking enough, is there anything else I should be on the lookout for when using for extended time? So dry eyes number one, so you already got that down. I'm so curious what you do that you work in VR for 8 to 10 hours. Wow. So yeah, dryness. The only other thing is the vergence accommodation conflict. Everything I've read, so that's where your focusing muscles are at a different point than your vergence muscles, or where your eyes are pointing, because it's kind of mismatched in VR and can cause eye strain. Everything I've read says that it snaps back, even for a long time. Now, I don't know if anything's been studied on someone that does it for 8 to 10 hours, Monday through Friday. You might be the top candidate for a study like that, to see if that's having any long-lasting effect on the muscle systems, the focusing muscle systems in your eyes. I'd be curious. Everything I've read says it snaps back, goes back. You might feel eye strain from it, but the systems regain or come back to each other. But That'd be the only thing that I would think of to look out for, especially that long time. I'll have to look. I don't know if there's been a study that's been that long. I'm curious though. Is there a connection between rubbing of the eyes and floaters? This is the current situation I'm trying to navigate. Thanks, Doc. Not as much as you'd think. So rubbing the eyes, kind of a normal rub, cleaning the eyes, itchy eyes type of thing, haven't been associated with eye floaters. Now, if you're a knuckle rubber, so you're in there, boom, boom, pushing the eye around, you're moving a lot of stuff around in there. You're moving the gel around. Stuff like that's been associated with retinal detachments. And so if it's been associated with a retinal detachment, where you're moving the gel enough that you're tearing the retina, I would automatically assume floaters. I should look into that. I'm going to put that on my list here to look into, because I don't know if a study can directly show that, but I bet you there is. I'll look it up. And eye rubbing. But as far as the normal rub, it's not. Your eye has a pretty good cushion to it, so it actually can withstand a lot of trauma. It's kind of crazy. Okay, thanks for answering. I wear glasses and have astigmatism in my right eye. My vision gets a lot more blurry when it's raining, even when I'm wearing my glasses. What can I do to help while I'm driving? Okay, so raining, driving, probably one of the top questions that we get in the exam chair. And it's just because that rain and light and fog and everything just like makes it extra difficult. Number one, making sure that your astigmatism prescription is up to date. That's usually the biggest contributor as far as rain, dusk, nighttime. So that'd be the top one. Outside of that, other than making sure like the windshield's clean and stuff like that, and your glasses are clean, there's not much you can do, especially with the rain. It stinks. Hello, doctor. I have dry eyes. My doctor said it's not reversible. Do I have to use artificial tears forever and every day? Oh, yeah. Loaded question there. So, and the reason why I say that is dry eyes, I try and avoid the word cure. Can we cure dry eyes? The answer is usually no. Kind of how we phrase it is this is kind of a condition that we always have to stay on top of. Kind of like weight. If our weight gets out of control, we got to control our diet, bring it back to homeostasis. So that's the thing. That's the thing with dry eye, is keeping it in homeostasis. I always try to get people to a point where it feels like they don't have dry eye, meaning it feels like it's cured. And sometimes it feels impossible. And sometimes people are just on teardrops forever. But my hope, and I'm always working for that, is to try and get people out of their treatment, out of drops. But sometimes it's really difficult. So I would hope not that you don't have to use artificial tears your whole life. Let's see. Don't know why, but most morning and nights. Oh, what? I can't remember the question that he asked. Thank you for taking time to inform us of important information, also for answering our questions. Hey, you're welcome. This is actually fun. Again, I'm probably not going to finish my charts. And I probably should actually... What? It's already been 30 minutes? Okay. Wow. I am bad at looking at time. I ramble here. What's your opinion on... Flutabok eye drops and Nabok and TheraFresh for dry eyes? I'm going to write this one down. I don't even know. Never tried them. I don't even know them. I'll write it down. That's the thing with dry eyes is there are so many more drops, so many more treatments that have come out that it is getting difficult to stay on top of what's out there and what to try. I have bloodshot eyes. Should I worry? Depends on what's causing them. Definitely try and treat it. Bloodshot eyes usually means there's some underlying issue, whether it's dry eyes, inflammation, allergies. And the hardest part is just figuring out what it is and treating the core issue. I wouldn't ignore it. A lot of people do deal with bloodshot eyes, I mean, for years, and try many different things, but I wouldn't brush it off. If it's bugging you, I would check with your doctor and see if you can find out the core issue there. Have you heard of Transition Lenses Gen S? Yeah, I actually went to Transitions Academy in Florida. This was in January when they launched Transitions S. Transitions faster, gets darker to category 3, which is category, I mean, pretty much you're in sunglass category as far as the darkness of the tint. Transitions faster going outside, transitions faster coming inside, so it gets lighter. So definitely better. I should soon hopefully get my hands on one that I can try it. I haven't tried it personally, so I haven't been able to like test it and everything, but it was a cool conference and looked pretty good. And they added a color. Then the colors are more accurate, so if you wanted to get color transitions, they're more accurate in many different shades, and so it looks pretty cool. Can you please visit Jamaica? We need help here with our eyes. Yeah, let's do it. That would be awesome. I'm very curious, how did you catch the dry eye syndrome? Yeah, good question. Mine is probably related to diet, at least how it started. Inflammation. I live in Idaho. It's a drier environment. I am a screen junkie, so take your pick, probably a mixture of everything. Guy, want to hear a joke? Why for the fire? Dr. EyeGuy from the banana factory? Yeah, because he kept throwing away the bent ones. Okay. I was not expecting to get a joke on here. Okay. Is it bad to sleep in your contacts at night? Yes. Yeah, so there are contacts that are approved, FDA approved for sleeping in them. I usually don't recommend them ever, just because of things that I've seen. I will say, however, though, the contacts these days, if you happen to sleep in them accidentally, or even a few days, I swear it's getting more and more rare that I find issues that happen. Probably the most common is people come in with a corneal ulcer, which can be pretty painful and hurt. That's probably the most common when they slept in their contacts. But yeah, still, I don't recommend it. Even the ones that you can sleep in, it's just, you can. Like there's certain occupations like firefighters, they usually wear sleep-in contacts because they need to get up and go at any time. And so it's good that you have the option. I have 2-week contacts, but my wife tells me it's bad to sleep in them, even though the packaging says it's okay. What do you suggest? Yeah. So my guess is AccuView Oasis. They are FDA approved for sleeping in for 1 week. Take it out, take a break, and then you can do another week. So they are 2-week contacts, but only approved for sleeping in 1 week. FDA approved still makes, I don't know, it's just like coming out of my mouth. It makes me nervous to say, yeah, go ahead and sleep in your contacts, just because of the stuff I've seen. But you are in an FDA approved contact to sleep in them, says it's okay. And if your doctor has looked at your eyes and said, hey, boom, go ahead, then yeah, you got the green light. My doctor said my optic nerve on my left side of my eye is a little bit larger than normal. She mentioned to come back annually to check on them. Is this something I need to worry about? So looking at the optic nerve, that is one thing that we judge and measure, is the size of the nerve and the size of the cup or the opening inside the nerve. The reason why, if one eye or one nerve looks bigger or larger, then that's when the red flag comes up for glaucoma. That patient kind of becomes a glaucoma suspect. I don't know if this is your case. I'm just kind of spitting out information and education here. Because in glaucoma, what happens, even in low tension, meaning if someone has normal eye pressure, if their nerves look suspicious, still worth to watch, because some people can get glaucoma and it'll cause the nerve to slowly get bigger over time. And if it's doing that, so right now you have a bigger nerve, it can be normal. I see that all the time. You can just have normally a bigger nerve than the other one, But if you come back annually and they start measuring slightly bigger and bigger and bigger, that's a red flag, and you want to find out why. Can be glaucoma. And so that's probably why she said that, is just to check for that. So, okay, how we doing? 40 minutes. I'm going to stop at 45 minutes. So you guys are awesome here. I got my glasses because I wanted them for fashion, but then my eye test said I had short-sightedness. So that was a win-win in your scenario. So you needed glasses to see far away, and you got them for fashion. So win, right? Thanks for answering my question. Please, Doc, are there any side effects of almost 3%? It can be. It depends on the person. Is that what you're taking right now? So that's actually in a few drops. So that'd be the question is which ones are you taking here? There's some drops that are just named that, and then they have that kind of in a few drops here. And I want to say it's Genteel, but I'm not sure. Where is it? I think it's Genteel. Sorry, doing this on the fly here. I don't know. I think it's Genteel. I think it's Genteel. So Genteel's the name brand, and I think that's in there. But yeah, it's for a dry eye drop. And as far as side effects, I mean, if there's a preservative in there, the preservative's can have side effects. So it kind of just depends on what you're doing, or which one you're taking. Hello, sir. My right eye is tearing and redness a lot. What should I do? I have tearing and redness in my right eye. So when someone has tearing and redness in one eye, this is where it's tricky, because it can be allergies, even though allergies is both eyes. One eye is kind of more unique. That's when you start looking in to see if there's one eye that has poor functioning meibomian glands, if it's causing more dry eye issues. I see that all the time, where some people have a more dry eye than the other, and it's causing it to water and get red. Sometimes if it's more red or watery in the morning, it could be a sleeping issue and an eyelid seal issue. So meaning one eye could be completely closed, one eye could have a little gap in there, and it will dry the eyes out and just make it irritated. You could be dealing with some papillae. That's usually both eyes, though. Ooh, that's a hard one. Definitely would want to get an exam, see if anything's going on. Hi from Russia. Holy cow. Hi. When I put the eclipse glasses over my glasses, can I see over the top and under? Oh, glasses, I can see over the top and under. Yeah, true. So, yeah, this is where it gets weird, because generally recommended to put the filter glasses over your glasses. The worry is if you put it under, especially for people that have farsightedness, high prescription, high plus powers. If you put it under, it can actually kind of focus or magnify the light rays, and so maybe the filter won't be enough. But just like this person just brought up, well, if you put it over, then you have this gap here, the top and the bottom, where the light can come in. And that's true. So so it's tricky. Definitely, it's recommended to put over your glasses. So if you do that, make sure that you don't accidentally peep over or under, but pretty much over your glasses and accidentally look at the solar eclipse. So you want to be careful there. If you have a low prescription, we're talking, less than a 3, then likely you're good to wear it under your glasses. But that's the worry of telling people to put it under their glasses. Do you follow the 20/20 rule? Because I'm not seeing you follow it over here. You got me. Yeah, I should. Well, when I'm on the computer, so if I was doing my charts, which I should have been doing, but I didn't, the 20/20 rule, I try and follow. I actually have a reminder on my phone that I put if I'm going to do a charting or editing on a video or something. I put it on my phone, and my phone reminds me to do it. Here, I hope I'm looking away spastic enough that and blinking and stuff like that. But yeah, you got me. You got me. I don't have the reminder going on my phone right now. My right eye is troubling since 1 week. It's tearing redness too much. Please tell me what should I do. It's hard. I can't recommend anything or treat or diagnose, but I mean, without knowing what the eye looks like, it'd be hard to even say anything to do. And so if you can, get into your eye doctor, because it could be a bunch of things that's causing it. Well, here's another joke here. What did the eyeball say when he was arrested? I've been framed, officer. Okay, it's a good one. Nice job. Yes, I'm taking hypermoles. Oh, so that is the drop. Yeah, then I don't even think you say that's why the name is different. Okay, so that's like the generic use. Yeah, so that's used in, I think it's used in a few drops. Oh, Gentile right here, yeah. So Gentile, famous brand of eye drops that's here. It's a thick one that sometimes we'll use. It's like a thick gel. We'll use it in a procedure called gonioscopy that we use on people's eyes. So we actually use that in the clinic on people's eyes when we're doing procedures. So it's a thick one, so it's a thick drop. What do you think would help the residency application to become an ophthalmologist? Is a high step 2 score enough? See, that's a good question. High step 2 score enough? I am not familiar with the high step 2. I don't know. I feel like I failed you on that one. Yeah, trouble since a week. Yeah, hard to say. My heart is troubling. Yeah, so I'm sorry. I wish I could say. I know it sounds like you're desperate, but really, the only way that I would be able to know exactly what is causing that is to be able to look at the eye. But I mean, it could be an infection, could be allergies, could be anything in the eye, could be dryness. It could even be something inside the eye, so inflammation. So meaning iritis, uveitis, inflammation that came from inside the eyes, especially if you're dealing with light sensitivity as well. So you definitely want to go to the eye doctor on that one. Is there any link between dairy and dry eyes? I feel the dry eyes coming after drinking coffee or eating dairy products. Yeah, especially when you're dealing with rosacea. So that's the inflammatory component. I think one of the top things in rosacea is to avoid dairy, to avoid the inflammation. And so, yeah, that definitely related to dry eye in a roundabout way. Why is there something rather than nothing? Well, that's a deep question. You went deep on that one. I don't know. You might be referring to something I said earlier, but I can't remember what. I'm sorry. Okay, for this I had issues with the left, but then I had prevention for that. And the other eyes were starting redness and tearing during reading and writing. Reading and writing, yeah. It could be a prescription issue. Hard to say. How long does blurriness and sunlight sensitivity last after small corneal abrasion? Wow, really good question. So I just had this today. I just had a patient. In fact, that's one of the things that kind of put me behind is a guy got jabbed doing a wrestling. Finger jab caused a big corneal abrasion. Yesterday came in light sensitive, painful, watery, huge corneal abrasion. So I told him the tissue can heal definitely fast. And in fact, tomorrow morning, I'm putting him on drops. Can do a bandage contact, but by tomorrow morning, the abrasion should be healed quite a bit. The light sensitivity, though, that can last a little bit longer because sometimes it can cause inflammation inside the eye and an iritis. And so we're going to actually watch for that. But that might last a few days. Hopefully not. It depends on the person, especially with it being a small corneal abrasion. Hopefully it's just a day or two and it gets better. So, but hard to say. Check in with your doctor. Make sure it's just corneal abrasion. Get the treatment and you'll be good. Is it possible to have one eye become secondary after 5 years of life? I never used sunglasses until 25 years. After I started using them, I have observed my right eye started to become primary. So I'm guessing like you have a switch in eye dominance. Definitely possible for sure, especially if you're dealing with prescription change. And sometimes it'll feel like that. Sometimes your dominant eye can have a prescription change where it becomes the more blurry eye. And so people think like, oh, wow, now my left eye is the dominant eye. But sometimes when you get it corrected, and so you put both eyes on the same level clarity, so 20/20, then the normal dominant eye kind of takes over again. And so, or it was already there, but it's just a blurry eye. That's definitely possible. It's possible that it can switch too. Do you think it's possible for nothing to exist, not even God? Yeah, we are getting deep here. Deep. Anything is possible, for sure. Does using prednisolone acetate for 2 weeks to treat vernal keratoconjunctivitis lead to glaucoma? So what we're talking about here is there are what's called steroid responders, so meaning, or steroid spikes. They take a steroid eye drop and it can spike the pressure in the eye. I can't remember the percentage of people. Man, I want to say, is it close to 20%? That might be overshooting it, but a good chunk of the population will have their eye pressure go up. Now, in that short amount of time, 2 weeks, I mean, causing glaucoma, no, but still you want to monitor and watch that pressure. So usually eye doctors, when they put someone on an eye drop, a steroid eye drop, they'll have them come back, do a pressure check the eyes, and if the pressure is going up, then you make the decision, okay, do you put them on a pressure lowering drop to keep the pressure down and stay on the steroid to treat the condition, or do you back off the steroid? Can be tricky sometimes, but usually in that short amount of time, no. But if you're talking about glaucoma raising eye pressure, yeah, can raise eye pressure for sure. But as far as that little stint of eye pressure, I guess it depends on how high can actually damage the nerve. So you gotta watch that. Greg, this is for eye questions. Yeah, he's going deep, huh? So right eye dominant, but read text with left eye when glasses are off. Was weird to realize. So I almost wonder if you have monovision. So meaning, yeah, so if you have one eye that's like better for distance and maybe one eye that's set nearsighted, better for close up, for some people can be a nice setup to have, especially when you're kind of getting into the bifocal stage. You have one eye that does one and the other one does the other one, kind of cool. I say cool because it can be a cool setup. Maybe not cool for you. Sorry, that was probably wrong to say. Is it true to cover a weak eye overnight for 1 week with black eye patch, and then another week the strong eye will cure the esotropia and make eyes align? And wearing prism eyeglasses, how effective? So no. So I'd initially say no as far as covering an eye completely for a week in order to treat an eye turn. Esotropia would it be an eye turn in. That alone, eye patching isn't necessarily to treat the eye turn, meaning that you're lining the eyes up. But usually when you're talking about patching, you are talking about making the vision in that eye improve. You're forcing the eye, or you're forcing the brain to use that eye to try and improve the vision, improve the development of that eye. And that is true, especially in the younger years, but not necessarily true for improving the eye turn. And so that's where the eye turn comes into looking into prism, definitely having correction, full prescription on there, especially if you're farsighted, surgery possibly. So it depends. Thank you so much. Hey, thank you for coming in. When I cross my eyes, one of my eyes goes back slower than the other one. Is that a lazy eye? Not necessarily. So lazy eye is kind of the catch-all term for either eye turn or eye that doesn't see as well as the other one. I mean, it could be related to that eye focusing, that prescription of the eye. They're kind of linked together. It could, maybe that eye does have kind of like a weaker muscle, but not necessarily a lazy eye. Yeah, hard to say, but I wouldn't, if you have that or just kind of slower, I wouldn't automatically slap the lazy eye label on you. Okay, thank you for your response. Doctor, I don't have a prescription and can see changes. My left eye is going a bit off after having my right eye started becoming primary. I see old photos and both were the same. Oh, so are we talking eye alignment here? So you have one eye that's starting to drift out. Sorry, I was thinking you were talking about vision, vision going off or blurry. If you have one eye that is starting to, yeah, okay. So if you have one eye that's starting to drift, or cross or go out, then that could be a completely other host of issues. Could be decompensating vergence ranges. So your eye muscles that have been able to hold the eyes straight are starting to weaken, and so that lets the one eye that wants to drift, it starts to drift a little bit more. But there's other things that can cause eye turns. Okay, so if this is just happening, definitely go in, get it checked out. Talk to your eye doctor. Make sure that that you have an eye exam, so they can just make sure there's nothing else that's crazy going on. Sorry, I must have misread your past comment there. Sorry about that. So would it be possible to touch eyes between two people? It would be kind of neat to see directly into an eye. Another great question here. Yeah, it's possible, but definitely do not do that. Yeah, that image was great. Good way to leave off there. Okay, so I went to the eye doctor, or I went to the doctor, and when they examined my eye and said I got eye pressure higher than normal, and didn't say much on it. Is it concerning? A way to naturally reduce it? Does screen time affect it? So, yeah, when you're talking about eye pressure, there is kind of a set number of eye pressures that's considered normal. But it's kind of take it with a grain of salt almost. There are people within normal ranges that have glaucoma. There's some people that are outside the normal ranges that have high eye pressure, and it's normal for them. They don't have glaucoma. They have ocular hypertension or just high eye pressures, but it's not doing any damage. So depends on the person, but a lot of times if they have high eye pressures, it can be a monitoring type of scenario where they might want to check eye pressures routinely, maybe bring that patient back more than a year, maybe 3 months, 6 months, check eye pressure depending on other things. So it can be concerning if there's other signs maybe related to glaucoma, but also could be, hey, you're kind of on the borderline eye pressure. That's the one thing we want to watch, and so maybe not too crazy concerning. Depends on the person, but naturally reduce it. I have a video I want to do about this. It's been a few years out. I'm hoping there's going to be another study, but there's a few years out where meditation and yoga and stuff like that has been shown to naturally lower eye pressure by a significant amount. So definitely stress is related to high eye pressure. If you can have less stress, meditate, can be beneficial. Screen time doesn't really affect it unless the screen time is causing a lot of stress. Where are you based? I'm in Idaho. Yeah, so a lot of people ask me that when I tell them Idaho. Either they don't know where it's at, or they're like, never mind, I don't want to go to Idaho. For our well-being, is it necessary for everyone to see an ophthalmologist for a prescription of the appropriate sunglasses? Good question. So sunglasses, if we're talking about getting sunglasses for UV protection, making sure that you have the correct sunglasses, not necessarily. I mean, you can find online for sunglasses. They don't have a prescription in it, but will have the adequate UV protection that are safe for your eyes. Now, if we're talking about getting a prescription to have sunglasses made, then yeah, so that's where you can get a prescription, and it doesn't have to be ophthalmologist. I'm an optometrist, and I write prescriptions for sunglasses all the time. But yeah, if you're getting nearsighted, astigmatism, if you want bifocals, you can make sunglasses out of anything. And so if you're going to be wearing the sunglasses without contacts, and you don't want to wear your glasses and you want to wear sunglasses outside, then yeah, you want to go to the ophthalmologist. They usually have the optometrist do it, but get your prescription so you can make them. Wow, I'm almost at an hour. Wow. This is fun, guys. Doctor, how long do you truly hope for a full eye transplant? My son's high myopia because of axial length, no pressure issues. Everything else is all good. He's just 5 years old and I'm too sad. I want to give him my eye. Wow, that, man, heart-wrenching here. So I'm scared to say, as far as a full eye transplant, as far as taking someone that has a high prescription and then transplanting the eye to give them an eye that doesn't have an eye prescription and having them see better out of that eye, that we are a long ways away from that, because a full eye transplant for that purpose would require them to figure out every individual nerve hookup from the eye to the brain. So as if the brain is registering and deciphering those nerves. That's going to be the biggest, hardest leap. So as far as full eye transplant from that's a ways away. There's going to be other surgeries, procedures that'll probably be better for him in that regard. But yeah. My kid is 6 years old and has a lazy eye. Is it going to heal by itself? It only happens when he's tired or he just woke up. So we're talking about lazy eye turn. Depends on what's causing it and how old he is. So a kid that is really young, we're talking under a year, eye turn. A lot of times kids will grow out of that. If we're talking about an eye turn that is caused from a prescription issue, so if a kid is farsighted, high farsighted, that can cause the eye issue. That won't heal on its own, but can be helped with glasses. So I wouldn't brush it off. Definitely go into the eye doctor and get it checked out. My husband has dreams and has had it since a child. He does not wear glasses or do anything. 041, what could help at this point? Wait, what? I don't know how to spell it. Strabismus. Okay, never mind. Autocorrect is irritating me. Strabismus. There you go. Sorry, I should have kept reading on. So your husband has strabismus and has had it since a child. Does not wear glasses or do anything. 41. What could help at this point? Has he been to the eye doctor? So if the strabismus, and this is common for an eye turn in, if it's related to farsighted prescription, sometimes by wearing glasses to correct the farsightedness can help with the eye turn. If it's not, if it's not related to that, then surgery might be the top option. It depends on the person, but yeah. See, I'd have him go if he hasn't been to an eye doctor. I'd go and have it checked for sure. God bless for your time and helping. Yeah, thanks. Yeah, like I said, I feel like I get as much out of this as much as you do, probably more. So. Recently had blurry vision for 5 hours. I have prescription glasses and now I'm a bit sensitive with light. Can you please give me a suggestion? So, man, blurry vision for 5 hours. Did you go to your eye doctor? I would go to your eye doctor, because I would, if a patient came in and said that my vision was blurry for 5 hours and maybe now it's better and they're light sensitive, I would want to check a few things out. I would want to look at the retina, see if there's inflammation going on inside the eye. We can check for white blood cells that are kind of floating in there. That can usually cause light sensitivity. Migraines, that'd be a pretty serious migraine though. They usually only kind of blur the vision up for 30 minutes, maybe an hour, 5 hours. I've had patients that have had it that long. So there's a few things there, but I would still get the eye checked out just to make sure. Are there any methods to improve myopia vision in kids naturally? Sunlight. So a big study, and we've kind of known this for a while, is, they're studying myopia control, what's correlated with people or kids getting nearsighted. And, the top one is, hey, less screen time, but they're finding natural sunlight, so going outside. So off the screens, kick them outside. That's kind of like the big natural one for sure, to kind of slow the progression of myopia. Do you think stem cell treatment can repair the eyes internally? So far, there's actually been a few things as far as stem cell injections for macula and improving vision is a thing and coming up. Hey, Sock, sorry. It's a muscle thing, I think. Yeah, so if it's a muscle thing and not prescription thing, then yeah, we're probably looking at surgery. I just had a patient a few months ago. She's 60, had an eye turn in her whole life, came in, pretty shy and kind of sensitive about it, and talked to her about the option of surgery. She didn't even know that was an option. She went down, saw a specialist, did a surgery. Next time I saw her, she was a completely different person, full of confidence, happy, bubbly, looked, excellent. She's going on a church mission now, so I wouldn't shy away from looking into the surgery if possible. I have a 70-year-old client that has glaucoma, 19 in her left eye, and is diagnosed with sickle cells or sickle cell disease, the cause of her glaucoma. So it depends on where sickle cell can cause artery issues and bleeding sometimes, retinopathy, and that can be linked to glaucoma and pressure and stuff like that. So it could be. Hey, doctor, can a lot of caffeine and lack of sleep cause blurring in one eye? One eye. I was only getting 2-3 hours of sleep for the last couple days with the newborn. It's can. So, so the definitely. So, and that could be. It's probably from like a dryness issue, depending on how you're sleeping and stuff like that. That would be my top guess, but hard to say. Could be with a newborn. Sometimes women have prescription changes after that, so that could be a possibility as well. Congrats on the newborn, though. That's cool. Does wearing contact lenses could affect my ability doing LASIK surgery in the future? Overwearing contacts that can cause ulcers and scarring can affect your eligibility to do LASIK. So if you're sleeping in them, overwearing them, you're prone to corneal ulcers and scars. It can for sure. Usually when people are wearing contact lenses, they recommend stop wearing them. Soft lenses is about 2 weeks, sometimes a month. Hard lenses is longer than that, just so they can analyze the cornea, the corneal shape, and the thickness after it doesn't have anything on the eye. And so it could, not common though, especially for people that are wearing their contacts how they should. How much fish oil would be enough to help dry eyes? Depends on the person. With me, it's a lot of fish oil. So I take the full dose, or I've changed because I am trying different fish oil right now. That's another test that I'm doing. So it's hard, but I take the full dose of PRN, or I did. That's the one that had the best effect on me. So in our office, we do the Omega Quants on people, and you can do this at home. There's an Omega Quant kit that you can get that it's a blood prick, and you can send it in. They can analyze the amount of omega-3s in your blood, and you can kind of correlate it to if you're having better dry eye symptoms, if your eyes are feeling better. So we do that in our office to see, if it's like at what level, people are having an improvement. So it depends on the person though. Much appreciated, yeah. Can you do laser surgery to relieve myopia on a patient who's had cataract surgery in the past? Yes, you can. Should be able to. It depends on the person, but there are patients that do that. So myopia and astigmatism is common enough that it's possible. What are the possible negative side effects for LASIK eye surgery for myopia? Big one is dryness. Usually they say it's can last up to 6 months. I have patients that that have had it since getting LASIK. Corneal neuralgia, so pain from the damage of the nerves. That's probably the stinkier one. Pretty stinking rare, but if you get that, can be brutal, can be painful. The nerves are damaged and they don't regenerate. So there's a few people I follow on TikTok that actually have had that, and I've been wanting to talk to them, but yeah, so you feel bad anyway. Okay, oh man, let's do this last one, and then I gotta go. I wear contacts. My right eye seems to get drier, colder than the left. Is this normal? Is normal for one eye, well, both eyes, but I've seen this where like one eye seems to be the more drier eye, colder than the left. The colder is the interesting part. I mean, that's a good one. You're stumping me on that one. Colder. Why would it feel colder? This is colder when you're wearing the contact, or when you take the contact out and the air hits it. Sometimes people take the contact out and they're like, whoa, that eye feels weird because it's kind of extra sensitive and the air hits it. Could be related to that. The colder feeling, definitely the dryness for sure. Yeah, it feels cold when you're wearing it. What? Okay, man, stumping me on the first one here. That was on the last one. I don't know about the coldness though. The coldness effect is interesting to me. I almost wonder if it's making that eye more sensitive. So it's just kind of responding to the external stimuli, maybe. Huh? But I haven't heard that one. At least I don't think. So I wouldn't say common on that one, but I would say common on the dry eye. It could be if the dry eye is making it more sensitive. You try Googling it. Did they say anything about the coldness? Hey, doctor, has already proven that IPL for dry eyes really works. Yeah, IPL for dry eye does work, especially when you're dealing with after you do IPL and you do meibomian gland expression, especially if you're dealing with rosacea or inflamed blood vessels. Destroying those can definitely help with dryness. Hey, yeah, you're welcome. What I do is move the contact off my pupil, and that helps. So you move the contact over, and your eye gets warmer. This is the coolest eye stream. Yeah, that's such a good question. I'm going to look that up. Cold eye, huh? Okay, man. This is the fun part about the live eye stream. You guys get to see me look like an idiot. I don't know the answer to the cold one. That's interesting. I'll look it up. Tyler P. Let me write this down. If I find an answer or I hear that, I'll see if I can. I'll do another live stream or something and answer it or something. So that's a good one. Okay. Well, I gotta go. I didn't even tell my wife I was doing this because I thought it was gonna be like 15 minutes. Look at this. Hour longer than I thought. Thanks for joining me. I'm super grateful for all of you. Super fun doing YouTube and everything. Even if not a lot of people watch, I'm glad I can help where I can. But thanks. I'll do another one of these. These are fun. Okay. Thanks, and stay focused. Gotta use the live. How do you end this? Oh man, now I'm gonna look like a noob here. Is it that? No. I'm gonna look like a weirdo for a little bit. Is it just the X? It might be the X. Hey, if this closes, we'll see. Oh, are you sure you want to stop the live stream? Yes. Okay. Thank you. Tell your wife thank you. Oh, I'll tell her. Okay, thanks. All right. Stay focused. See ya.